For the procedure of doing a UBI treatment, you're going to need a 250 ml empty evacuated Vacutainer bottle. You're going to need vented IV tubing, preferably 96 inches long.
Hold it up and take a look at it.
As a vent for the glass bottle. You have to have vented tubing to go with the glass bottle. We will send the cuvette package, which just tears open, and it contains a quartz cuvette with a male and female and male lure lock, 25 cc syringe with a needle, 5,000 cc's of heparin.
5,000?
5,000 units. I'm sorry, 5,000. Thank you for asking. 5,000 units of heparin. Some hemostats or clamps, a way to clamp the tubing. And you'll need to obtain, actually we could probably send a handful, maybe have a couple hundred. We'll send with you some 21 gauge and some 19 gauge butterfly needles for the venipuncture, for the venous access, and alcohol swabs. You'll need a bag of saline, 0.9 sodium chloride saline, and the machine, and a tourniquet, and that should be all. Some gauze and some tape, gauze and tape also, which you can obtain pretty easily at a local pharmacy. Okay. To start, we're going to take the syringe out of the package, the needle out of the package. Go ahead and connect those. 5,000 units of heparin. This particular vial is 0.5 mLs. We're going to draw that up into the syringe. And then we're going to draw saline up for the remainder of the 25 cc's in the syringe.
You're kind of in the way.
Yeah, I know, but they know how to draw up saline. Okay. Syringe has 5,000 units of heparin and 25 cc's of saline. Next, I'm going to take out the vented tubing. We're going to connect it to the cuvette. Locks in, make sure it's tight. Now we're going to flush the bottom half of the tubing. Take our syringe and our needle, put it in the access port. Bend the tubing over. Flush until your saline reaches the end. You want to clamp the tubing beneath the port to hold the fluid in, and then you're going to back flush the remainder of the tubing up to the drip chamber, which requires just a little bit more than the 25 cc's we have. So we're going to set this down and drop more saline.
Why don't you get off the side and we'll look at that. Hang on.
And go ahead and drop another 25 cc's of saline. We're going to finish flushing the tubing until we have saline in the drip chamber. saline in the drip chamber. You're going to roll your clamp shut, pull your syringe out, and recap. Okay. Set all my tubing on the table. And we will access a vein at this point. Alright, Roy, I'm going to have you hold my tubing for me here, if you would. A little bit different setup than we're used to. Just have you hold on to the, yeah, either hand's fine. Put that right there.
So this is the new,
That's the new cuvette. Prior to accessing the vein, you're going to take your cap off of your glass bottle, take your cap off of your vented spike, and you're going to puncture the vacutainer bottle. Tom, can you hit pause?
Explain.
Okay, we're going to apply the tourniquet, and we're going to find a good vein to access. Now you can't scream on tape, all right? That's the forbidden. You can wiggle your toes. You can't yell. Go ahead and hold that for me. Okay, here we go. Yeah. Lick your lips, wiggle your toes, whatever you gotta do. That's a good spot right there. I'm gonna get my hand under yours here. Okay, pull. Okay, we're in. Okay. Access the vein until you see a flash in the needle. Apply your tape, your first piece of tape. Make sure you have a good blood return. At this point, I don't. Sorry. Still on, Tom?
Mm-hmm. Explaining.
I'm going to try and draw back some blood here to see. I'm obviously not exactly where I need to be.